Hello, this is Ajay Nikita from Radio City 91.1. Every time I come with a guest talking about one or the other thing, especially about the expertise that they have in their fields. And right now we have Dr. Mutturaj Kiyar, who is going to talk about how to combat obesity. I think because of our lifestyle right now, post pandemic, or just before that as well, probably we may not have given much importance or have shed light on those things, and today we are going to know certain myths or the things that we are about to know, we should know, which we can inculcate in our lives. So, our heartiest welcome to you, Dr. Mutturaj, who is a consultant, Department of
Thank
Advanced Laparoscopic GI Bariatrics and Metabolic Surgery, Ritika Surgical and Eye Clinic, Bangalore. Namaskara, doctor.
Namaskara.
How are you doing, doctor?
Yeah, hi. See,
Great.
yeah,
Yeah. So, doctor, usually you deal with many people who has certain disorders or diseases like type 2 diabetes or whichever is connected to abdomen, the gut health. So, can you
mm.
kindly introduce yourself when it comes to the specialization, being a surgeon in bariatric surgery and the treatment of obesity? Can you kindly introduce yourself?
Yeah. I'm Dr. Muttaraj, advanced bariatric surgeon. I'm practicing since in Bangalore since last 20 years, especially in surgical and other bariatric surgeries.
Mm-hmm.
So we have various surgeries we have been performed, not only the basic bariatric, we are doing the advanced bariatric, even the revision procedure, endoscopy balloon, and so on.
Mm-hmm.
Especially in this Bangalore, where there is a the poor sector, especially people who are not able to offer for this. Yes, we have serving for them without any surgeon cost, free of cost except consumable. We are operating them also.
Mm-hmm. Great. Doctor, there are certain questions that I have to pose it to you today. As in, these are the general questions that most of us have. And this is a wonderful platform or an opportunity for you to converse with all our audience and, let them know what it is exactly. So, while understanding about morbid obesity, can you define morbid obesity and explain how it differs from general obesity?
The weight, according to the weight, the according to body mass index, we classify normal BMI, overweight, and obesity. So BMI means body mass index, weight in kg, height in
Mm-hmm.
meters square. Normally it should come 24.9 to 25. That is the normal body mass index anybody should have. But
Mm-hmm.
when the body mass index crosses 25 to 30, we call it overweight. When
Okay.
it is when body mass index is more than 30, that is called obesity. Again, in this obesity, again we classify class 1, class 2, class 3. 30 to 35, we call it as class 1 obesity. 35 to 40, we call it as class 2 obesity. And more than 40 is class 3 obesity, that is morbid obesity.
Okay.
So,
It's like the,
yeah,
the next extreme stage. Okay.
yes. And the treatment also varies according to the body mass index. It is not same for everyone.
Mm-hmm. So this is the major difference between the morbid obesity and the general obesity. So
Obesity, yes.
how often is morbid obesity seen, doctor, as you have treated many?
See, this now the in the worldwide, if you see, the obesity is increasing, especially after post-COVID. The obesity has increased, and nowadays we have a childhood obesity. So basically, it's all this increasing multiple factor. One is westernization of the food and lifestyle, and various other factor, the genetic, and so this obesity is increasing in trend. That's why World Health Organization has declared as a morbid obesity as a disease because it's associated with many diseases also.
Right. Talking about that, what are the health risks associated specifically with morbid obesity and how prevalent it is?
See, morbid obesity per se, people think the obesity means beauty, no need for intervention. Many people, even now, they think that obesity means if the weight reduction only for cosmetic intervention. No, the World Health Organization has declared obesity as a disease. Why? Because people who are obese, especially morbid obese, that likely getting the type 2 diabetes almost 8 to 9 times more than normal body mass index people.
Okay.
And they can suffer with sleep apnea. The BMI more and more higher, they likely they're getting the difficulty in breathing. That we call sleep apnea, where carbon dioxide level will go down in the brain, and that's how the oxygen level go down and carbon dioxide level increases. That cause hypoxia. So there are
Mm-hmm.
other conditions like cardiac disease that usually people who are morbid obese they are associated with this almost this incidence also 8 to 10 times more higher than the normal body mass index. There are various other disease like severe reflux disease, gallstone disease, joint problem, osteoarthritis, and various other cancers also associated. And in female it can cause PCOS, infertility, and male it can cause infertility also.
Mm-hmm. Right. So you have told us what are the obesity, I mean, what might lead to obesity. But I mean, what might happen if you have, morbid obesity. But before that, while talking about the causes and contributing factors for obesity, like factorial, like genetics, sedentary, life, hereditary, and so on, what are the primary causes of morbid obesity, doctor?
See, morbid obesity, as I said, each one will be having a different set point.
Mm-hmm.
People, what they think, if they are obese, let them eat less, automatically they reduce weight. That's what people, their relatives and friends,
Generally
they advise,
believe.
generally believe. But only the patients knows how much they're eating. They'll be, in fact, they'll be eating one tenth of what others are lean person is eating. Still, they cannot lose the weight. This means the
Yeah.
body GT absorptive mechanism that changes. That can be due to one is genetic, hereditary, and of course, definitely the westernization of food definitely increase the obesity. But then we cannot think only in terms of only if they eat more, they'll get more obese, more obese. If they eat less, they can reduce weight. No, it's not like that.
Mm-hmm. Right.
Basically, the
And
set point is different. Yeah.
so it's genetic and hereditary as well. So you mean to say.
Yes. Yes.
Okay. Right. And what are the treatment options available for morbid obesity, doctor?
Yeah. See, they people think that first thing if they come to know like they are obese, what is the treatment? People will go for this in online. First thing they'll search in Google or they will ask friends, what is the treatment? Or someone has undergone treatment. So what to all they will ask for the diet plan. Yes, diet, exercise definitely acts as a role, but
Mm-hmm.
there is limitation. It doesn't work out for everyone. So only people with the 25 to 30 BMI, only for them the diet and exercise as a role. In it can hack even the balloon or liposuction, which is a body contouring, can hack between 25 to 30. But when the body mass index is more than 30, that is obese. When they are obese, unlikely they get killed only by diet and exercise or any balloon therapy will help you. If the BMI is more than 35 with any other comorbidities, then there is no other treatment other than bariatric surgery. Means it's a keyhole procedure through small camera we keep and we change the absorptive mechanism of the stomach. So that's
Mm-hmm.
how the digestive system is changed in such a way that suppose one person is 150 kg, his ideal body weight is 70 kg. We change the digestive system such that within a period of 1.5 year, he will attain that 70 kg. In a healthy way, you lose that.
Mm-hmm. And while talking about bariatric surgery, what are the different types of bariatric surgeries and what are their benefits and risks, doctor?
See, this is a very good question. So the bariatric surgery, people think they get confused. First thing is they'll see in the TV or other things, somebody is the death happened. They don't know what surgery is done. Weight loss surgery means everything same. They think like
Yeah.
weight loss surgery. There are various types of various surgeries there. Not everything is not bariatric surgery. The liposuction is different surgery and bariatric surgery is different. The liposuction means removal of fat, but in bariatric surgery, we are not going to remove the fat, but we are going to change the absorptive mechanism by a small like pen type instrument. Through that small camera, we go inside the abdomen, we change the absorptive mechanism. In that bariatric surgery, there are various procedures. One is sleeve gastrectomy. means
Mm-hmm.
stomach size will be reduced. Almost 70-80% of the excessive stomach will be removed. Only around 20 to 30% of stomach will be intact. By doing that, patient will start losing the weight, and also their appetite stimulating hormone ghrelin, which is being secreted by the stomach, will be gone. So that's why the appetite also goes down. And other surgeries like gastric bypass, it can be one anastomosis gastric bypass or Roux-en-Y gastric bypass. These are the gold standard for the weight loss procedure, where bypass means we make the stomach pouch smaller size and also bypass them. This bypass is not same for all the patients. Suppose you are 100 kg means the bypass length is different. If you are 150 kg means bypass length is different. If you are 200 kg means you have to attain 70 kg means we keep a higher bypass length. Like that, each patient, the bypass surgery, even though name is same, the surgery differs because according to bypass.
Right. And how do you consider a patient is a candidate for bariatric surgery? And what are the criterias that you follow, doctor, usually?
See, the bariatric surgery, not everyone is fit for the bariatric surgery.
Mm-hmm.
First thing, we have a guidelines to select for the bariatric surgery. Suppose any person, you have the body mass BMI 25, if you come and do bariatric surgery, we cannot do for. So there is a guidelines, the Aussie guidelines, American Association of Obesity guidelines, where they says that minimum the international guidelines is different. The 35 BMI should be there with either of one or two comorbidities like type 2 diabetes or hypertension or sleep apnea or heart problem or any other comorbidity should be there. That is what they. Of the BMI more than 40 without any disease, without any comorbidity, they are eligible. But in India, especially in Asians, if we go in terms of the fat and muscle composition, the Western people are more muscular than Asians. That's why the Aussie guidelines has decreased the BMI 2.5 down. Means people who are 32.5 only, they'll be eligible for a bariatric surgery. Of course, there is a controversy that even 27 point BMI above, if they have type 2 diabetes, there is various bariatric surgery procedure is there, which will be helpful for the diabetes. In that way,
Hmm.
it can be done. But if it is 32 point above 30 BMI, yes, they are eligible. If they are less than 30 or if it is around 25, 27, they're not, usually it's not advisable to undergo bariatric surgery. They can undergo other procedure.
Right. And is bariatric surgery covered by health insurance? Which other insurance company covers bariatric surgery, and what is the criteria to cover it in health insurance, doctor?
So, first of all, last question only, I want to tell one thing. The
Mm-hmm.
bariatric surgery is that same safer surgery than any other surgeries. The first thing patients will come and ask is, sorry, is it safer? Because in the TV or other program they'll watch some death has happened. Is it safer? First of all, you should know that any person who is obese, they'll be having many disease, comorbidities, heart problem. If you undergo any surgery, the same risk will be there. Even if the person is obese with a high pregnancy, that is called high risk pregnancy. Pregnancy is called high risk. But obesity, because of obesity, that will be high risk. Similarly, it is a safe procedure. And now, since last 10 years, the bariatric surgery is being covered by health insurance, central government health schemes like CGHS or BSNL portal, all they are covering. In the private insurance from October 2020, they're covering bariatric surgery in the health insurance. Until that, it was not covered. Many people went to court after undergoing bariatric surgery. They cured the diabetes, sleep apnea, and the court directed it has to be covered. From HIRD also given a guidelines from October 2020. All the health insurance should be covering this bariatric surgery, and irrespective of it depends upon the insurance company to insurance whether it's a cashless and other thing. It is same as that of any other surgeries, but it will be covered by all the health insurance.
That's a good thing for somebody who is looking for it. And doctor, can you share some success stories or the patient testimonials from the many years of your practice in this field, doctor, as a bariatric
See, there are
surgeon?
various stories are there. One the person was 36-year-old BMI. He came to me severe sleep apnea. He was not able to breathe, and he used to use CPAP for a normal ventilation. He cannot breathe because he was using artificial ventilation. Night time he was not able to sleep, and he started developing cardiac problem also. So he went and approached one of his close relatives who are cardiologists, and they advised him bariatric surgery. When he came to me around 3 years back, he was almost 152 kg. That time he had a difficulty in breathing with diabetes, hypertension, and major worrying is the sleep apnea. Now, after he underwent surgery, within 1 year, almost he came to from the 150 kg, he has come to 70 kgs. Now he can do normal respiration. Not only the sleep apnea and diabetes is cured, he was afraid to go to any shopping also, because whatever the dress for him it's not available, he has to stitch it. And he had people who are obese, they'll be having a lot of depression to use the shopping also, because most of the shops their size won't be available. So these are the things he was sharing with me. And that's how it is not only with the disease per se, it is psychologically many people get depressed because of obesity. That's why once they undergo bariatric surgery, our patient will be keep checking every day whether I'm losing the weight, whether I'm losing the weight. But it takes 1.5 years to attain the targeted level.
Mm-hmm. Okay, right. And how do you support a patient throughout the weight loss process, before and after the bariatric surgery?
See, the bariatric surgery, first thing is they need a support. When the person comes with only obesity or any other disease, they take the advice. They are
Mm-hmm.
not only they have to get convinced, they have to get convinced from the family members. Many family members oppose that when the patient
Mm-hmm.
wants to undergo that, because he will be you might have seen some patients who undergone surgery, but the family members have not seen. So first we have to counsel the family members, and we have to tell the advantage of the bariatric surgery. It is not cosmetic, and what all the advantage after the undergoing surgery. And also we have to assess patient risk factors, and we have to optimize him for a surgery. Then during the surgery and the post surgery, again after the surgery, we have to counsel the patient, because many other issues will be having. Then we keep in a patient support group. Patient support group means all the patients who have undergone bariatric surgery, they will in that group, they will share their experience, whether it's due to diet, or if they small symptoms, if any vomiting happen, why it happens. Suppose if they eat once after the surgery, if there will be stomach size is smaller, if they cannot eat more as before. If they eat more, there can be some vomiting sensation. So all the thing, when the patient support group is there along with the doctor and the dietitian, so we can assess the patient when their maximum weight loss period 1.5 year, whether with the first every 3 months we do the blood test. Any deficiency happens means the first 1 year we expect. That is the reason we, because the maximum weight loss happens in this period. We do the blood test every 3 months. We have to assess that, and the dietitian will give the diet program, especially in the first 4 weeks, because immediately after the surgery, we want to, patient may not take the normal diet. First 1 week clear liquid, second week semi solid, third week soft diet, but they can go to office next day itself after the surgery. Only
Mm-hmm.
thing, they have to maintain the diet.
Right, right, right. So, doctor, why is it more necessary to emphasize on morbid obesity and its treatment?
See, the morbid obesity per se, it is cause huge strain and the family and even the government also, because
Mm-hmm.
this obesity, people who are more obese, whether they have a disease or not, likely getting comorbidities which like diabetes, hypertension, sleep apnea, heart problem, are almost 10 times more than the normal body percentage. So
Mm-hmm.
the cost of treating them after getting the so much severe disease will be more expensive, more burden to the family member and to the nation. So
Yeah.
the, let's say, one type treatment, bariatric surgery, will save the cost and will save the patient.
That's more important. Yes. And finally, at the end of our conversation, doctor, is there any tip that you would love to give to our audience right now?
So whenever you are have a disease, don't search only through Google or YouTube. There is a lot of misnomer do happens. People who search in Google, they take some treatment in online and all these things. Ultimately, people have gone to some liver issues and all this. That's why always it's better you to meet the weight loss specialist, get their advice, and accordingly get the treatment. Only by seeing the Google, don't take any tips, because the treatment of your weight loss, there are various factors are there. Whether what is that body mass index, what is their comorbidities they're having, are they eligible to just diet and exercise, or the other treatment has to be done. Only the specialist can do that. Please approach the nearest specialist. They can advise you in the better way.
Great, doctor. Thank you so much for your valuable time while talking about how to combat obesity and also certain information which are required uh, to this world which talks about the bariatric surgery. Thank you so much for your time, doctor.
Thanks a lot.
That was Dr. Mutturaj KR, consultant, Department of Advanced Laparoscopic GI Bariatric and Metabolic Surgery, Ritika Surgical and Eye Clinic, Bangalore. And right now, signing off, RJ Nikita from Radio City 91.1. Thank you.
Radio City, Radio City, Radio City, Radio City, रग रग में दौड़े सिटी।